Hi everyone, Dr. Remy from Pain Free and Fit. Today we've got a great self-treatment healing exercise that you can do at home for spondylolisthesis pain in the lower back. This exercise addresses the common problem of latissimus dorsi or lat muscle dominance. Hope you enjoy. So the lat dorsi muscle runs from our shoulder down into our lower back. It actually attaches to the vertebra in our lower back and the iliac crest or pelvic bone. And many times, due to abnormal posture habits, a dominant side, a weak buttock muscle on the other side, because the lat muscle also has a connection through fascia to the opposite buttock, one lat muscle becomes dominant or stronger or tighter than the other side. And when we have a tight lat muscle, it has a tendency to overarch the lower back. And if you've enjoyed any of our videos on spondylolisthesis healing exercises before on the channel, you realize that when the arch in the lower back, the lordosis, becomes increased, meaning the tailbone comes up, the pubic bone drops down, the rib cage tilts backwards, that many times aggravates a spondylo because in spondylolisthesis, that bone that slipped forward, the back portion of the spine, the back portion of the disc, the facet joints become imbricated or compressed, aggravating a lot of spondylolisthesis pain. And that's why many times abdominal exercises, especially those that emphasize tail under motion or posterior pelvic tilting, help with spondylolisthesis pain. So we don't want tight lat muscles, and sometimes they occur on both sides, but many times they occur on one side becomes more dominant over another, because in our daily activities, in our reaching, in our lifting, in our even walking pattern, that lat is having a tendency, every time it's being used, to overextend or to increase that arch in the lower back and irritate the back portion of the spine, irritate the spondylolisthesis, and mechanically suggest to that vertebra more motion or more stress moving forward, which aggravates the spondylo pain. So to determine if you have a tight latissimus or a dominant lat muscle, take one finger and place it right on the midline of your lower back, right on those bony knobs known as the spinous processes in your lower back, and take one arm at a time and reach upwards and slightly across the top of your head. Now normally that spine should not move away from your finger. That bony knob should stay pretty stable if you have a normal lat or lat dorsi flexibility. And you can do that to both sides, tensing right and left. And at a certain point, if you notice that bone on your finger starts to move forward or soften against your finger, that indicates that that lat muscle is tight. And if you notice one side is tighter than another, meaning that vertebra moves away more, or you can't get your arm across as far, that also indicates a dominant lat muscle on that side. So how do we correct this? One of the simplest ways to do it is because we walk so many steps each day, most people walk between 5,000 and 10,000 steps a day, why not use walking to retrain your latissimus muscle for equality so that there's a symmetrical pressure on your spine from right to left sides, and we stop the asymmetrical pull that aggravates spondylolisthesis. Now we can do this simply before we actually walk with a little pre-walk exercise, which is, let's say my right lat was tight or dominant. It's the one that when I reached overhead, it didn't go as far to the other side, and it created more of a pull away from my finger on my lower back vertebra. If my right lat is tight, many times that's related to the opposite glute or buttock muscle being weak, because as this buttock weakens, its synergist or latissimus has to helper muscle has to tighten more. So what we're going to do is when we take a step with our left leg moving backwards, meaning our right leg is forward on the side that our lat is tight or dominant on, we're going to emphasize squeezing that buttock on the opposite side. That's going to engage the buttock. And if you've taken any of our videos on glute activation methods, you know that holding the tailbone slightly under or tensing the tailbone under or pubic bone up towards our rib cage or our chest helps to activate that glute because it decreases the contribution from the lower back muscles. So as I take a step forward, I'm going to emphasize squeezing the opposite lat and softening the movement or the swing of that arm backwards, because as the arm comes back, that lat muscle is working. And remember, this lat muscle on my right side I determined was too tight or too dominant. So I want to soften the the swing of the arm going backwards, meaning without as much vigor, without as much tension, and emphasize the opposite buttock as I step with that side. If I have a tight lat on both sides, then I want to do it on both sides. I want to emphasize buttock tension and softening the arm swing backwards to ease that particular latissimus contribution to the overall motion. If I had, let's say, still a tight lat on my right side, when my right leg comes back and my left arm comes back, because remember, as we walk, opposite extremities, upper and lower, move in the same direction, I'd want to emphasize the left arm with more vigor pulling back. That's going to wake up that weaker latissimus and help ease the side-to-side stress on my spine from above. So after you've practiced this in the standing position, you can actually plug it into your walking cycle, where as you walk, remember you want to be softening the backwards motion or easing the backwards motion with vigor on the arm where you have a dominant lat and squeezing the opposite buttock. And you want to be emphasizing the opposite arm, the one that's not dominant, the non-tight lat. You want to emphasize that arm swing backwards as you take a walk. Plugging these into your daily routine over time will help to loosen the lat, and daily stretches by keeping the tailbone tucked under and raising your arm up and over will help to stretch the lat. Again, stretches can vary from holding the position of a mild stretch from 15 seconds up to a minute or two. You can also do that holding on, let's say, to a rack or a wall, where you keep the tail under and you bring the arm overhead and you lean your body into the side of the tight lat, and you'll feel a stretch from your shoulder down to your lower back. Make sure that those stretches are mild. If you overstretch, you're going to elicit a response from the muscle spindle, which is the receptor in the lat muscle that's telling you that it's being overstretched and could be damaged, and then it's going to tighten the lat. That's not what you want. You want to make sure you use a very soft, mild stretch. Better to do 2 or 3 levels of that stretch than one big stretch to stretch your lat out. If you like this video instruction on tight latissimus dominant muscles, please feel free to subscribe to our channel. We got a lot of other great exercises for spondylolisthesis. If you're looking to include a tailor-made spondylolisthesis healing program for yourself, please go to the painfreeandfit.com website. We have a great fast-track healing exercise program that gives you a full body analysis to determine all your mechanical and posture issues. It gives you pain relief exercises built on that, stretches, coordination exercises, strengthening, stability exercises, and how to take your present fitness level with your spondylo and bring it back into pain-free return to sports and general fitness. If you'd like to help me share this vital information with others, give me a thumbs up below. I hope this exercise series on dominant lat muscles helps you with your spondylolisthesis pain.